Hi, I'm Austin LaBarge, and this is my Whittaker Assignment. I thought Whittaker's book was very interesting and very eye-opening and educational, personally. Ever since I've been learning about mental illness, I've always thought person showed symptoms, went to the doctor, or went to a psychiatrist, was diagnosed, given medication, and they adjusted back to normal life. I find now that this isn't the case. I feel that medication is very harmful and not very that helpful to some patients. Medication is driven solely on the profits for the pharmaceutical companies. They are push their medication even though they know it's not that beneficial to some clients. Some clients have not very good reactions. They keep pushing for it at the make profit at the expense of these families and the patients because they have nowhere else to go. And personally, I feel that mental illness is not just a brain disorder. I feel it's much more complicated than that. I feel that it's not just chemical imbalance, because we learned in class that this is true. This isn't true, it was created by pharmaceutical companies to help market their drugs, which help make more money, because more people think it's just that simple. I feel that mental illness is a combination between environmental factors and biological factors. And by that, I mean biological factors. If somebody has a family history of mental illness, whatever mental illness it is, and I feel like some people are just predispositioned to be diagnosed with a mental illness. And by environmental factors, I mean that somebody does drugs, like powerful drugs such as heroin, cocaine, the list goes on. If they were abused as a child, and not have a very good home life, they're exposed to other poverty, other risk factors. It all comes into play when being diagnosed with a mental illness. I don't think it's simply just one event. I don't feel like it's that they have chemical imbalance or something wrong in their brain or body, or just because they had one bad thing happen to them in their childhood or throughout their life. I feel like it's a combination of these factors, and it depends on the individual. And I found a very interesting piece of research conducted by Matthew State from the University of California, which he states through his research and generally concludes that there's new thinking on how mental illness is caused by biological and genetic factors and environmental factors, which helps prove my personal hypothesis. And this article goes on to state how this is shaping how we treat mental illness. We're not just taking a medical approach, and we need to take different approaches depending on the individual, which I thought was very interesting, and I kind of agree with. And I feel like the recovery model recovery in general is very debated in mental illness, because there's so much speculation and so many different opinions. If some clinicians stress medication as their only way to help these people, then I don't personally agree with that, because these clinicians have ulterior motive. They can be paid through pharmaceutical companies to push the medication that the pharmaceutical companies have. Like, athletes get endorsed to support Nike or wear Nike. It's the same thing with these psychiatrists. Pharmaceutical company pay them extra to prescribe this medication, and this is an ethical issue. It's not fair to the client. It makes the client even more vulnerable that they're given medication that doesn't help them, and this book helps show that. I'm not saying medication is the worst thing. Some patients have positive reactions, and medication helps them live a normal life and control their symptoms. But some people have very bad reactions to medication, and it makes them feel like a completely different person. Or the book states how it makes them sleep for days. If a person's sleeping 16 hours a day, how are they supposed to have normal relationships and a normal life, hold a job? It's not really any different than just having dealing with their mental illness. It's just as debilitating to me personally. And this is why some clients would rather just deal with the symptoms of their mental illness than take the medication and feel like a completely different person. And I completely understand that. In the book, The Center Cannot Hold It, I just recently read it, shows how Ellen wanted nothing to do with medication, and how she felt on different medications, and it showed eye-opening to how debilitating these medications can be compared to the mental illness. I feel personally recovery should be a balance between the two. I feel we should incorporate more individual and group therapy sessions for these clients if they don't respond to the medication, and that medication should still be involved, but at lower, safe dosages that don't completely debilitate a person. And I feel that resilience comes into play depending on the individual. It affects their recovery. I mean, some people can respond very well and come through with their illness just like any other medical condition, but some people there's not much we can do once we do what we have to do. I found another very interesting piece of research from the state of Wisconsin where they adapted with their mental health care system. It encourages to helps the people dealing with the mentally ill to help them encourage their internal conditions such as hope, their health, their empowerment and connection, and incorporates their external conditions such as making sure their basic human rights are met and their services are provided. I feel like this is a good mix between the two. It shows us our job as social workers and healthcare professionals, and it shows what the client has to do because some responsibility is on the client and our resilience. And I feel that support systems are very, very helpful in treatment. It helps the client. The client is doing what they're supposed to do, taking their prescribed medication, going to the therapy sessions, but goes and sleeps under a bridge every night, or doesn't have anybody to talk to or love them outside their treatment team, then the client is going to respond well. I mean, support systems are just as important as everything else. I feel that stigma and discrimination are the biggest crippling forces for the mentally ill. I feel the biggest problem with stigma and discrimination is because mental illness presents itself. It's very frightening and very uncomfortable for people who aren't educated and aware what mental illness can do to somebody. And I always found it very interesting and shocking that mental illness doesn't gather and gain the same empathy and sympathy, concern for people as illnesses like cancer or any other serious illness. People feel like mental illness scares them, and they don't take it seriously. They think people just need to suck it up or move on with their lives and get it together. I found a study conducted on varsity football players. It was a very small study, and they asked their feelings about mental illness, and it says that generally they feel that people need to suck it up with mental illness. I feel like this ties into our culture. I mean, I'm a young male. When I was younger, growing up, if I bruised my knee or got hurt, I was always told, suck it up. You're a boy. And I feel like this is translated into our healthcare system with mental illness because people don't want to deal with it because they're scared of it. So people feel like mental illness need to suck it up. And I feel as social workers, we need to help move towards a more compassion, empathy towards the mentally ill population. I feel it is, besides our client being our sole responsibility, our client's welfare, that is our ethical duty to advance human rights of the mentally ill through education, so people understand the warning signs of mental illness, how to interact safely, and how to get the person the help they need, how debilitating mental illness can be. People don't understand this, and we can't help people. We can't change this perception in our society unless we help educate these people. And I feel like a book like Whittaker's can really be eye-opening and help these people learn. This book and research I have done for this assignment has drastically changed my perception and thoughts on the use of medication. I feel that there are some positive aspects of medication, that people do respond well, and it does help some people very well. But I feel like there's a lot more reform that needs to be done, a lot more research. The entire antipsychotic medication industry needs to be reshaped. This goes inside the American healthcare system. Our healthcare system is privatized, and companies make more money treating the symptoms of a disorder or disease than they do curing it, and it's a sad but real truth in our country, in our healthcare system. And I feel like the mental health care system and our healthcare system in general isn't going to change until we shift away from this privatization and have healthcare situations similar to Canada or the other European nations, and other European nations. I mean, patients will still be forced to take this medication that doesn't help them and feel different, and there's really nothing we can do about it until that changes. Whittaker does a very good job at bringing up the issues with antipsychotic medication in our mental health care system. The first-hand accounts of the book really hit home for me and made me realize that, wow, this is what these people go through. It changed my perspective. I feel if people just read these books, it would help them greatly. help them understand more. I feel a take-home message from this book, it provides professionals a new perception of mental illness. Personally, this has shown me that we need major reform in our mental health care system. We need to look at mental health care in a more complicated, empathetic manner. I feel as a society we need to look at it, mental health care from a social work perspective more. Looking through a medical model is also beneficial. I don't feel like it addresses all the issues such as housing, support system, family, all that stuff. Where's this person sleeping at night? Are their basic human rights met? Maslow's hierarchy of needs, are they met? Through the medical model is designed to treat the patient, which that's what medicine does. But I feel like with a social work perspective, all the patient's needs will be met. And this will help make the situation better for the client. Our profession can make the most impact in this area. Population, but we must incorporate this in the rest of our society to really make a change. Thank you.